Okay, so today we're going to show a live assessment of Buzz's knee. So apparently she was doing some kung fu with a panda. I don't really know what happened. And so she has hurt her knee. So we're going to look at this, just really quick, run through a quick assessment to kind of see if we can figure out what's going on. So she says it hurts on the inside, so medial aspect and posteriorly right here. A day or so ago, she stepped and twisted, and so when you twisted, did it pop? No pop.
Pulled.
So it pulled, but didn't really pop. So could be just hamstring related at the insertion. We want to make sure it's not the meniscus because that's always a concern. You know, especially when twisting is involved. Make sure the meniscus is okay. So we'll go through a few tests and kind of see. So you know, the first thing we're going to do because of where the pain is located, I'm going to do just to run through a valgus test just like this. I'm doing a valgus test to check for the MCL. Does that increase your pain or anything there?
Burns.
So a little burning, but not so much here. You feel it more around back when I do that, right? Yeah.
Yeah, right there.
So and I would check it. I'll go ahead and just kind of reach across and check, and that feels pretty consistent as far as stability in comparison to the other side. So I think the MCL would be okay in that case. Plus, she doesn't have a large amount of swelling, and then also she is able to get the knee flat, so that also can be some issues, kind of a red flag for possible MCL injury. And so then we're going to do a varus check. So I'm going to go this side, just a light varus. Do it a couple different ways. I'll place my hands in different points. Nothing there.
Yeah.
That was uncomfortable.
Yep.
I didn't feel any gapping with that, but it was uncomfortable when I did that. And so when I did that, it feels like it pinches back here. So the pinching, even though the varus test for the LCL would be negative because she didn't have reproduction symptoms on the outside, I didn't feel slack on the outside. I am compressing or pinching the meniscus on the inside, so that could be positive for meniscus. Now what we're going to do is I'm going to bend her knee a little bit here, just like this. Now with an anterior drawer, just to run through this, and in a lot of cases, I like to do this with a person lying flat on their back just to try to take the hamstring out of this a little bit. But for our purposes right now, and because it's just Buzz, we care about her, just not just a ton. But anyway, no, I'm just kidding. So we're going to just check it like this. So I'm going to block her foot here and pull. And so that anterior drawer would be negative, and the posterior drawer also feels negative. I didn't feel any excessive slack either way with that. So that's good. So now we're going to do a McMurray's. So I'm just taking it going through here. I'm trying to see if I feel or hear a click or a catch, you know, because what we're doing is we're trying to, yeah, a little bit there's uncomfortable there.
Yep.
Right when I go right there, you feel it. And so we're trying to see if we can capture a piece of the meniscus back there being entrapped. A lot of times with like a bucket handle tear or a flap of the meniscus will come up. You'll do that and you'll catch it. I mean, again, sometimes if I can't get any provocation of pain or symptoms, I would lie on her back and go all the way through. I change the range of motion, change the force that I'm using just to kind of see. And so in that case, again, that is suspicious, the meniscus there. And so I'm just going to have her pull her leg straight down. So pull down for me.
Nope.
And that's painful there.
Nope.
So, you know, you might go straight to meniscus again, but then also hamstring could be involved with this. And so she didn't have any bruising or anything there, right? No bruising. The hamstring does bruise, and so she could have bruising here. The hamstring would be more likely to bruise unless she had a complete tear of a tendon. It's going to bruise more out in the muscle belly, out in the middle where there's a lot of blood supply. So, you know, the meniscus also will swell. Now, if you have a meniscus injury, remember, the meniscus is pretty avascular, so you might not notice swelling right away. That's something that over time, the next day or so or several hours, start to notice the swelling, you know, start to come in. So, you know, I shouldn't have any significant swelling there right now, right? So, and nothing under the kneecap. So I'm not even testing things around the kneecap, patellofemoral stuff, because she doesn't even complain of pain in that area, so we're not going to worry about that. And so now we'll do an Apley's compression test. I do that a couple of different ways. Actually, you know, the test is set to be done in prone. I'll start it a lot of times with a person in long sitting. I'll recline her back a little bit. I'll just start it like this to see what I get in a couple of different positions. And again, this is just kind of my own modified version of this. So I'm pushing in on her foot up this way, compressing the knee, and then I'm going to take and I turn. Is that painful there?
Yeah.
A little bit on the inside there. Pressure. And what about there? Pressure. Not like sharp stabbing pain. So I would do it that way, and then I'm going to bend the knee. I bend it to around 90, and of course we'll get into a deep knee bend test here in a second. So I'm going to put one hand here. I'm going to compress this in. Anything there? A little uncomfortable there, but it's not terrible. And so again, I've just got her knee bent to about 90 degrees and just kind of squishing while I'm rotating both directions. And again, I would just do this before I put her in prone. We will check a deep knee bend, and that's uncomfortable. Yep. Pain on the inside there, right? So we'll just check the other side just to see about how far. Range of motion is good. A lot of times with a meniscal tear, like a posterior horn tear or a root tear, you might not have that full deep knee bend range of motion. So now I'm going to get you a spin around, Buzz, and face that way. We're going to lower this down. Now she's going to go on her stomach with her head facing on this side. Okay, I don't want to lose my knee here. Still on the right knee. I'm just kidding, the left knee. See, making sure you're paying attention. All right, so now I'm going to bend this to 90 degrees. I'm going to press down. I like to stabilize just below or above the ankle here. I'm pushing down, and then I'm rotating. Yep. And that's painful on the inside. Mm-hmm. And I'm going to push in and internally rotate. Yeah. Mm-hmm. And that's painful as well. Same location. Yep. And you also can do this taking pressure off. That was my wrist that popped. That's okay there. So if I take the compression off, it's not bad, right? So now, just to do a little hamstring checking, I want you to hold your knee in this position. I'm going to try to straighten the knee out. So you hold it there. Don't let me straighten it. Is that painful at all? No? And then straighten it out. And that was pretty strong, right? The hamstring felt pretty strong. I'm going to compare the other side. Hold this right there. Don't let me pull it out. That's not bad. She's right-handed. No, she's left-handed. And so the right side is a little bit stronger than the left, right? So being left-hand dominant, I would expect her left side to be a little stronger. So because of some irritation here, was a little weaker on the left side. I could check that with a handheld dynamometer, but just for the purposes for this, it was pretty close. So I think I could rule out hamstring in this instance. I think that this is going to be a meniscus issue. Hopefully not a significant meniscus tear, maybe just irritated the meniscus, maybe not a full tear. So definitely I'm going to have Buzz probably go to orthopedic and then have some further imaging done just to double check. And then if she needs surgery, of course, I'll Google what to do and do it here at my clinic. So that's just running through a real-time knee issue here. I hope this helps, guys. And again, if you think you're having something going on with your knee, you definitely want to have that checked out, especially if it could be possibly a meniscus or something like that, because that can just lag on and just keep nagging you. And so you want to get it checked out and get it resolved. So make sure you head to my website, ChadGOrthoOT.com. You're going to find information related to orthopedics, sports medicine, rehabilitation, and links to some awesome products. Thanks so much.